Hey everyone, good morning, good evening. Today we have our student, Dr. Nikhil Tondehal, and he has a very unique profile. He joined directly into psychiatry fellowship. So, geriatric psychiatry fellowship without any US clinical experience. He had extensive work experience in his home country. He had done a residency. So, we want to understand what it takes to get into the fellowship directly in psychiatry and then how to go about it. So welcome, Nikhil. How are you?
Thank you, Pawan. I'm doing good.
So let's start with your background. Tell us a bit about your year of graduation, MBBS, and then you were doing your residency and teaching in India. So tell us all about your journey so far.
I've graduated from MBBS in the year 2010, and I've done my psychiatry residency in India from the year 2012 to 2015. After that, I did have 1 year of senior residency experience, following which I did join in a medical college as an assistant professor. So that was till the year from the year 2018 to the July 2021. I did join the geriatric psychiatry fellowship this July, and I did get my ECFMD certification after my post graduation. So that was in the year 2017, and that's how I was ESMG certified for the fellowship.
So not many people have been able to do this in terms of directly into the fellowship. Of course, in internal medicine and all but psychiatry is a difficult thing to crack, and it is getting more and more competitive. So let's start off by asking, what do you think programs look for when they are looking at, say, fellowship applicants that you managed to do? What are they looking for?
I think most of the fellowship program do look for, of course, a residency program in the core specialty. But also what matters is, I think, the publications and some sort of research activity to show that you have been active in the research and it's not just only clinical oriented. So that does help. If there's a work experience which you have done after home country residency, that does count as a clinical experience on your part, maybe not as a US clinical experience, but it does count as a experience in the field. And I think when you come to psychiatry, I think it's very important to show that you're genuinely interested in the field. I think that is a really, really big factor. So when you do have a home country residency and you have at least few years of experience in the psychiatry field, so I think that does answer the point. So there won't be a question like, why are you interested in psychiatry, or why are you interested in this field? So I think it's very important that you leverage that fact that you are already in the psychiatry field and you're interested in the specialty. So that is a very big factor. Coming to the particular fellowship program, I think it's essential that you, based on your home country experience or your residency, you should bring out why you're interested in the field, because there may be addiction, there may be consultation liaison, then there is geriatric and child adolescent. So if you're applying for one particular fellowship, so why you are interested in it? I think here it becomes important that you bring out your experience from your residency and your work experience. So possibly like mentioning that a particular field is underrepresented or it's underdiagnosed in that case. So you could use that to say that you want to gain experience in the field. I think when I did interview for the fellowship position, so my US clinical experience, I did want to get hands-on in something. Of course, observerships were difficult to get by. So I did explore this option that I do have a home country residency and I do have I have work experience as a teacher in the medical field. So I did want to look up if a fellowship positions are available and if programs are willing to consider. So I think most of the discussion it went around was around the teaching experience and also what type of cases and what type of difficulty was faced. I think that is where it played a key role in getting the fellowship.
What prompted you to explore fellowship first, instead of the usual route?
Yeah, one thing, of course, as I mentioned in the COVID, observerships and hands-on was difficult to come by. And even if it's an observership, because of the psychiatry confidentiality and HIPAA regulations, you don't get to do much of, patient interviews or even getting some hands-on experience in that aspect. So fellowship was an opportunity where you could get a clinical experience as well as hands-on, and of course, it's an additional degree. So I did have, I think, there's an option that in case if a particular fellowship does not have a suitable candidate, then they can take an international medical graduate who meets the criteria, who meets a particular set of criteria, which includes having a residency and clinical experience. And of course, the fellowship committee at the hospital must must agree to the fact that the criteria was met. So I think these factors were something that I thought, okay, we can see if some of the fellowships are willing to waive the main requirement of an accredited residency program and do consider under this criteria. This criteria is there in the ACGME rules and regulations. So this was there for psychiatry, for the few psychiatry fellowships, because even psychiatric wise in the United States, few of the fields are still need to be strengthened. So they do have this criteria which allows the fellowship positions to be filled. So that did help.
And when it came to searching for fellowships, was it through FRIDA or did you have to go out on your own? What were the sources?
Mainly it was FRIDA, because FRIDA does have a complete database. So I did look up all the fellowships and on the FRIDA, and of course there was the fellowship match that does happen at the end of the year in July and December. But thing is, most of the psychiatry subspecialties do not take part. It is only the child and adolescent that takes part. So I had to individually mail the programs that I was interested in, look up in FRIDA, and then mail them and inquire if they're willing to consider me as a candidate. I did forward my CV. So in that way, a few programs did respond, and few did say that they cannot be flexible with the criteria.
Of course, you were our student, and you know the interview preparation for residency and the kind of questions. So in terms of interviewing for fellowship, how was the interview different in terms of what they were asking and what they wanted to know? Was it in-depth, your psychiatry experience, cases, or was it usual as they would a residency applicant?
Right. I think a few of the components are still overlapping when you come to the residency interview and the fellowship interview. Of course, they want to know you as a candidate. So I think those questions will be common in both the residency and fellowship interview. But when you come to the fellowship interview, I think the discussion surrounds more about the psychiatric experience that the candidate has. And in case if you're applying for a particular fellowship, so the discussion will be regarding the cases and what made you choose the fellowship and what do you expect to gain from the fellowship. So I think there will be a few deep questions into the field and into the cases that you've seen, and probably a few questions on how you treated a particular case. So I think in fellowship, for the fellowship interview, that is different from the residency, but otherwise, knowing as a candidate, the questions are still the same.
So just to summarize, in terms of applicants who are interested in fellowship, I think it goes without saying that they need to have home country residency.
Absolutely.
And they should be having sufficient experience to be able to justify and discuss their interest in the fellowship. So that's clear. Now, in terms of the future opportunities, so one of them, of course, would be to go back to get into a residency in the US after this fellowship. What would be some of the other opportunities or options?
Probably when I did come to know that few of the fellowships, a few of the other specialties do have this option that if you do 2 or 3 multiple fellowships in a particular state or in a particular area, you are able to get the license, state license, and you're able to practice without having to do residency. I'm not sure which specialties they are, but there is that option. There is that option to maybe bypass. I wouldn't call it as a bypass, but you can practice in only that state. So it is a localized license instead of a full license. There is a local restricted license. So that one option is available. And of course, having the clinical experience does help in the residency application, because even while you are doing fellowships, you are connecting, you are making connections. And so that may be in the state or even within the hospital. And so that advantage is still there. And I think doing the fellowship now does give an advantage, so that you don't have to do an fellowship after the residency. So you are preponing something. So I think, yeah, time for older graduates like me, age and time is a big factor. So yeah, in case because if observership is not an option, so you could also do that. So probably anyway, if you wanted to do a fellowship later, if you do it now, so you're also saving on time. I think that's a big consideration for older graduates.
I think that's a great option for people like you who may have already done residency at home. So finally, any parting tips for other students, anything that we may have missed?
The important point, I think I did learn this at Sarthi, actually. I was not aware of how important it might be. The program outreach is really important. I think the core part of how I got into the fellowship was program outreach. So it's nothing different when you compare it to being a fellowship or a residency program. Program outreach, you still put yourself out. Yes, most of the times you do not get a response, but after all, you need one response to make things work. So you'll only know that when you go for the program outreach. I think that is something that I really learned. And I would suggest for the students that it's not possible to have possibly program outreach and maintain a conversation with, say, 150 to 200 programs. You can choose you can choose possibly your top 10 or top 20 choices, and keep a conversation going from the off season, because when it is during season, you're not going to get response, and that is normal. That is fine. There's nothing to be dejected about it. But in an off season, you do get response from the program directors, and as well, even if not program directors, program coordinators do respond. So from the off season, if you select your top 10 or top 20 choice of programs where you want to match, or it is your first, or say, it is preferable choice, those 20 programs, you can keep the conversation going from the off season till this in season, so that possibly bringing a lot of information to the program coordinator during the match season. So when obviously they do not have the time. From the off season, I think I would suggest that from the off season, you keep the conversation going with at least your 10 to 20 choice programs. The rest of them, okay, you can keep sending mails, but top 10, top 20 is something that you can keep on you're going to keep on going through, and it's doable. I think if you start from off season, I think it's doable. So that I think is really important. Program outreach is really important. Yes, in residency season, it does get you interviews, but if you're doing before, that still does play a role. So you are still in their list, you are still in their site, and they know about you, and so it does help. Program outreach is a really important aspect, and that is something that I learned here, and that was the reason how I got the fellowship.
Yes, thank you. And of course, you continue to be our student, and hopefully we'll get you into a residency as well. But
thank you. Fingers crossed.
Yep. Thank you very much, Nikhil. This was very, very helpful, and I think it'll help a lot of students who are in your shoes.
Thank you, Pawan. I'm glad I could share the experience.
Thank you.